She has a big heart, big wings, and a big commitment to restoring the magic to communities. Welcome to the Fairy Godmother Show.
Okay, so now next question is, and we're, you know what? Let me just read a couple of comments right quick. So we got a couple of comments that people have sent in, and they said that they were coming because they really wanted to learn more. They want to learn all that they can, and that they. Another comment was that Cuomo announced on Tuesday that it would be in the Armory and that there was no information. They tried calling, people were hanging up on them, and just all kinds of, madness was happening. And rightfully so. Like you said, it was only 200 for how many people? And so I could kind of get that. Also, another comment and sort of the question is, why isn't there a transparent sign-up list where, something larger that people can kind of get a feel of where they are on the list and how soon they would be eligible to actually get, the vaccine. There were.
So on that point, in just in fairness to the counties and the providers who are administering these shots and signing people up, they don't know how large their shipment is going to be basically until they get it. And so, that's probably part of the reason why they can't say, oh yeah, you're scheduled, 2 weeks from now, we expect you'll be able to come in and get a shot. And that's because, there's been such inconsistency in the supply. Now, hopefully, again, that gets better, and I think it is getting better. But it's hard to tell someone when they're going to get a shot when you don't know how many vaccines you're going to have the next week. So that I'm sure is part of it. But one thing I will say, Orange County, and I've spoken many times with the county executive about the vaccine rollout here in the county. They've set up a website where you can basically sign up and be notified when appointments become available for you to sign up. So I'll put that in the chat, but it's vaccination.orangecountygov.com. And so if, these appointments, like I said before, that, they get a supply and the appointments are gone in like 15, 30 minutes. By the time you get in front of a computer, there are no appointments left. So if you go to that site, you'll get notified once there are some openings.
Great information. So I'm hoping that we can get a running list from the great people that work in your office so that I can actually put this information on my Facebook page and then on my website as well. So if someone wants to actually kind of refer back to it, if they did not have an opportunity to attend this meeting, we can also be able to provide it to them as well. But also, too, I'm planning on doing a watch party, possibly 2, so that we can really make sure that we get widespread as possible, get this information out there for people. So, thanks a lot. Okay, and yeah, and so just a feather in your cap, I thought I'd give you a little bit of a kudos there. One of the people that actually registered today said that I don't have faith in my newly elected state senator, and I'm looking forward to being kept informed by Senator Skoufis, who follows the science and not the politics. Thank you.
Okay, well, I appreciate that comment. And, we get in a lot of trouble as a society when we start to make health decisions based on politics. And look, sometimes it's unpopular, right? Who wants to shut down businesses? Who wants to tell people, you're restricted in what you can do? And, that's not anything that I think a leader ought to want to be communicating to folks, their constituents. But, we saw for a long time what happens when we don't follow the science, and hopefully lessons were learned. And this is about keeping people safe and keeping people alive. Money is money. And we need to, on a parallel track, rebuild our economy and rebuild our small businesses, and that all needs to happen. But we are tasked as a society, as government, with trying to keep people safe. And so that happens when you follow the science. And I pride myself on that, and so I appreciate that comment.
Good. So we've got a couple more, and then let's see. Right. So we've got what type of non-congregate housing options is being used in your district to safely house the homeless during the pandemic?
That's a great question, and honestly, there's no good answer. I know that the state is increasingly looking at using unutilized hotel rooms. There are not a lot of people traveling, so the hotel industry has really been decimated, and there are a lot of empty rooms. And the state is increasingly looking to see if that can be used effectively as an option for homeless New Yorkers. But there's no really good answer. I mean, it is to the question's point. There's no. It's a very high risk setting being in a shelter. It is a congregate setting, and that's the most dangerous place to be. Whether it's a nursing home or whether it's a group home, whether it's a homeless shelter, that's where the disease spreads very quickly and very dangerously. And so we have to do more and better. The hotel idea is, I think, one that's worthwhile, but I don't have a silver bullet to share with you right now.
Okay, so we're getting down to the wire. So we've got the big question, which I kind of put them all together because quite a few people asked the same, which is you sort of went over this a little bit ago. Actually, when you first started, you really kind of talked about it, which is where can our seniors at this point look to get the vaccine in and around Orange County, and is there any place specific in the city of Newburgh? Are there going to be any places in the city of Newburgh in the very near future?
Yeah, so there are two types of vaccination sites. There are state-run sites. The closest one to here is in Westchester. There are very few of them in New York. There's one out in Long Island. I think there are a couple in New York City. So the closest one, or the Hudson Valley one, is in Westchester. And you can sign up for state-run sites at the state's vaccine website, the state's website. Then there are county and provider-run sites. You can go through the portal. You can sign up through that Orange County website that I mentioned before that alerts you when there are appointments, and you can reach out to your providers starting Friday. There are, like I said before, there are pharmacies that are going to become COVID-19 vaccine providers. So you can reach out through their websites starting on Friday. And so that's how we do it. And what I would just encourage people, whether it's on this issue or other concerns about the vaccine or questions they have, if you can't find what website to go to, or who do I call or where do I go, just reach out to my office. You can email, you can call. The email in my office is very simple. It's Skoufis, SKOUFIS at nysenate.gov, and my Newburgh office phone number is 567-1270. If nothing else, we can at least point you in the right direction. But so it depends a little bit whether it's you're going to a state-run site or a non-state-run site. But we can certainly help you along the way if you can't find out where to go.
Okay, and we are, I like to keep my stuff tight. I'm at 8:02 already. So just a couple more, which is the big thing for me, which is important. So what would you do to actually improve communications between the county, the city, and the constituents? by the time people hear about this, with the vaccines, it's long gone. But there is clearly, and it's not new. It's not just this situation. I've been in this game a long time, so I know it's not new. Communication in the area is a big hole. So what can we expect in terms of an improvement in communication?
It's a great question. So look, I think there's certainly room for improvement, and there are only a certain number of ways you can communicate with people, right? You can communicate by phone, which includes, robocalls, but also live calling people. You can communicate by email. You can communicate human to human in person, which is a little, we don't want to do right now amidst the pandemic. And we can communicate to the media. I think that's it. Like maybe social media as well, right? So like there are no magical, additional doors to talk to people. There are, 3, 4, 5 different ways you can. And for the media, if you can get a newspaper, or whether it's a weekly newspaper or the daily newspaper or Spectrum News or whatever, there's constantly information coming in through those outlets. Not everyone gets the paper or has cable. I get it. And so, sign up for my emails. My office sends out periodic emails with lots of good information. Sign up at that county website that I mentioned before. So I'm committed to doing more and doing better. I like to think, we can all do better, including the county and the city. But information is gold right now. And, when you can find out when the appointments are coming, where to go for the appointments, that's the name of the game. And that requires getting the word out. And so we all have to do more.
Absolutely. So I think I just want to thank you for that. That's great. And I know that, again, communication and the breakdown of communication did not begin with COVID. There has always been a communication issue in and around the city of Newburgh in particular for, a long time. And so hopefully, I'm hoping that with COVID, what it'll do is help us to get this communication thing not right, but definitely better. I think that it has forced a lot of us who, and I know we hate it, to do Zoom meetings all the time and, all of that stuff. But I think people are more responsible when it comes to checking their emails now, and just, really trying to find alternative ways to be able to kind of stay in touch with what's going on around them. I think people are trying harder now. I do want to kind of throw this out there because I don't want the people, there are 5 questions here that I'm not going to ask the state senator because it's in my opinion, I believe that it's outside of his area of expertise. And I think that it would be unfair to put him on the spot. So I'll just give you a couple examples. Someone wrote and said that they have kidney disease and they're at high risk and they want to know whether or not they can get vaccinated. Someone else said that they had vision problems, knee operations, and where can they get the register to get the vaccine. And then someone else asked whether or not if you get the vaccine, should you continue to be tested for COVID? So, I mean, I'm not going to put you on the spot, Senator, to answer, any of those, because in my opinion, and I'm not a professional really, but I just kind of think that might be more that your private physician might want to answer those kind of questions.
I would just say on the first couple, look out for, again, in 5 days, February 15th, people with comorbidities, serious health issues, many of them become eligible. So keep your eyes out for that eligibility list, exactly the specific conditions that are eligible, and see if yours is there. And if it is, then you're eligible. And certainly consult with your doctor before, if you have medical concerns about getting the vaccine while having one of these conditions. To your point, Aquanetta, I can't I don't have a medical degree. I can't offer that kind of advice
Exactly.
or guidance. But on February 15th, you do have that expansion of eligibility.
Okay, good. Yeah, because I know my doctor actually, he talked to me about it as well. And because I'm diabetic, and so he was talking to me about that. But I just want to thank you again for spending some time with me here with what I call my Ferry family. And because these are some wonderful folks who really care about their community. They come out, they support, they take information back to their friends, and so they are great at really sharing good information. And for me, like I started off by saying, that was key. I hate hearsay, I hate all the gossip. I really like to hear, not for nothing, James, I want to hear from the horse's mouth. I want to hear what is the state doing for us. And I think that you provided a lot of that information. I did get some questions about some other issues, but I did notify the people that we were holding fast to the topic of COVID. And so I really would like to invite you to come back at another time so we can talk about other things that's going on, in and around the state that, affect us, our quality of life. If we can do that, that would be wonderful.
Look forward to it. Very good.
Good, wonderful. Okay, so we are after 8, and I did tell people that it would be an hour. And so I'm going to officially, do I see a little hand? This is so funny. This little hand has been up. Anne used to work for the city. She retired from the city of Newburgh. She worked there 100 years. So she's got this little hand that's been up for 5 minutes. Anne, are you still there with a question? I'm just curious. Or did you forget to put the hand down? I think she forgot to put the hand down. Okay. All right, good. I was just checking. I had to give seniority a little respect, But okay, so we are going to officially bring the meeting to a close. We have now backed Senator Skoufis into a corner and got a commitment that he will come back and join us on other topics along the way, if not just this topic. We can talk about this again, but there are other things that are going on in the world that we probably should be discussing as well. So we're looking forward to that. I want to thank everybody for joining me. I'm going to seek to put this on Watch Party tomorrow on Facebook. And then once again, probably on Saturday, I want to make sure that we maximize this great information and share it. And so I just want to say, when you see it on social media, please feel free to share it with your friends, family, and coworkers so we can stay up to date as much as possible. All right, so I want to say thank you again to everyone who's joining me.
Thanks very much, everybody.
Thank you.
Be safe, be well. Good night.
Thank you for joining us. We can't wait to see you next time right here on the Ferry Godmother Show, where we are restoring the magic to life and play.